Hi, I'm Dr. Aanchal and today I'm going to tell you the causes and treatment for blackheads and whiteheads. At the end of the video, I'm going to tell you what remedies you can use at home in order to reduce the occurrence of blackheads and whiteheads. इस वीडियो को हिंदी में देखने के लिए ऊपर आई कार्ड में प्रेस कीजिए. So what are these blackheads and whiteheads? We refer to them as comedones. So on our face, we have a lot of fine thin hair which we refer to as villous hair. So there is a gland attached next to this hair, and this entire unit of the hair and gland is called a pilosebaceous unit. So whenever there is blockage of this hair follicle with either sebum or skin debris or keratin, this leads to formation of a comedone. If there's a thin layer of skin on top of the collection of the skin debris and sebum, then this leads to the formation of whiteheads. Okay, so when this comedone is exposed out in the environment, this leads to the oxidization of keratin that leads to appearance of blackheads. So these are basically precursor lesions of acne. Okay, so you'll notice that people who have a lot of acne or have oily or combination skin, they develop mostly these blackheads and whiteheads, mostly in the forehead, nose and chin area. Acne lesions are mainly of two types, inflammatory acne and non-inflammatory acne lesions. Okay, so inflammatory acne lesions are the ones which appear very red, the papules, nodules and cysts and pustules where you can see these yellow dots. And non-inflammatory acne comprises of these blackheads and whiteheads. So these whiteheads can actually lead to formation of red acne. Okay, so we want to treat these whiteheads so that they do not form these red inflamed acne lesions in the future, and also to reduce the chances of scarring. So when do we see these blackheads and whiteheads? They are most commonly seen in people with oily skin, with people with combination skin, and also in people who use a lot of cosmetics. Okay, so when you apply a thick layer of cosmetics, this can actually block the pilosebaceous unit and lead to accumulation of sebum in this area and causing formation of blackheads and whiteheads or causing exacerbation of these lesions. If you apply a lot of hair oil, that tends to trickle down on the forehead and sides of the face and lead to occlusion of this opening. This can also lead to formation of these lesions. It is also seen in people who sweat a lot. So if you work out and you apply makeup or you work out and you sweat a lot, then that can also lead to occlusion of these openings, and this can lead to the formation of blackheads and whiteheads. So how do we treat? Basically, we want to reduce the accumulation of oil and this keratin in the hair follicle opening. Okay, so you can use a chemical exfoliant. So you can use creams and gels that contain salicylic acid. Salicylic acid tends to concentrate in areas where there are oil forming glands. Okay, so it's very lipophilic. So when it concentrates in these areas, it tends to shed the dead skin and lets the oil come out smoothly. Okay, so this leads to reduction in the formation of blackheads and whiteheads. So how can you use the salicylic acid? So you can use salicylic acid as a face wash formulation. You can use 2% salicylic acid face wash. So first you will wet your face. On damp face, you'll apply the face wash, lather it on, leave it on for about 30 seconds to a minute. Try to form a foam on the forehead and nose and chin area, and also on the cheeks if you have a lot of blackheads and whiteheads in this area. Remember to not use too much force and try to rub it in. Okay, so be very gentle with it. Try to foam it on your face. Leave it on for about 30 seconds to a minute, and then you can wash it off with lukewarm water. This will help in loosening the keratin and reduces the accumulation of sweat and dirt in your open pores. You can use Salicylic DS face wash, Salicylic face wash, deep wash face wash, or Neutrogena oil-free face wash. Or you can use any other face wash that has salicylic acid in it. Okay, so make sure that you're gentle with it, and you can apply it twice a day if you have oily skin. If you have combination skin type, then you can use this face wash only once in a day. If you have dry to sensitive skin, then you want to use this face wash only twice or 3 times in a week. Okay, so you can titrate the number of times you use it according to how your skin responds to it. So it can make your skin a little dry. So as soon as you wash your face with this face wash, you want to make sure that you apply a layer of moisturizer. So you can use a gel-based moisturizer such as Ryza, Excella, Acrophy. These moisturizers are non-comedogenic, so do not occlude your pores and do not make your blackheads and whiteheads worse. And it also very gently moisturizes your skin. So you can use any of these. If you have a lot of blackheads and whiteheads which are not getting better with the use of face washes, then you can even use a salicylic acid gel overnight. But remember that you can use the salicylic acid only if you have oily skin, okay? If you have dry sensitive skin or even combination skin type, sometimes the salicylic acid when left overnight can really irritate your skin. So you can use gels such as Zitcare S or Sebonac gel or Sebo gel. Okay, so this can be used in a small quantity. You can apply it in the areas where you have a lot of blackheads and leave it overnight. You can also use a retinoid cream in a very small quantity in the areas where you have these lesions and leave it on overnight. Remember that retinoids are best used when it is under a supervision of a dermatologist, and it is best to use it with a prescription of a dermatologist. Okay, so if you have any kind of side effects or you're not able to tolerate, you always have somebody to go to. These retinoid creams are really helpful in reducing the sebum production and also shedding the dead skin layer. So this really helps with your blackheads and whiteheads. If you have oily skin, you can use Retin A in 0.025% cream, okay, in a very small quantity at night, and leave it on entire night and wash it off in the morning and apply a moisturizer. When you are starting off with a tretinoin, you can apply it in a small quantity and leave it on just for an hour and wash it off, use a moisturizer and go to bed. This way, if you start tolerating it, then you can leave it for longer time. So let's say you can leave it for 2 hours the next day, then 3 hours, and then you can leave it overnight if you're able to tolerate. Okay, so it's always better to start retinoid in a small quantity for a short period of time, see how you react to it, and then continue. I have a detailed video on tretinoin. You can click on the iCard above to watch. If you have sensitive skin or combination or dry skin, then you don't want to use tretinoin because that might cause a lot of irritation. Then you can use an adapalene gel. So you can use either Adaphren or Deriva MS gel. Use these in a very small quantity, just a pea-size amount on the affected area, and you can leave it on overnight. And make sure that you moisturize your skin well twice a day. Also, these retinoids tend to make your skin very sensitive towards the effects of the sun. So you want to be very diligent with the application of sunscreen during the day. If you have a lot of blackheads and whiteheads, then it is best to visit a dermatologist to tackle this problem. Okay, because these can sometimes lead to really inflamed acne and also leave behind scarring. If you have a lot of these lesions, then we may put you on some oral medications as well. So please visit a dermatologist if you have a lot of these comedons. So what are the home remedies that you can use? So please remember to not use any kind of lemon or any kind of harsh scrubs on your face in order to remove these lesions, because they are going to do more harm than good. When you try to forcefully extract these lesions, it can leave behind a really nasty black mark and sometimes also lead to scarring. So you want to be very gentle with removal even if you want to attempt it at home. So you can first wash your face with a salicylic acid face wash. Okay, leave it on for about 2 minutes and then you can wash it off, and then take steam for about 5 to 10 minutes, and with a comedon extractor you are going to gently remove these blackheads. Comedon extractor is available on Amazon, so you can buy it and use it very gently. Remember to not apply too much of force, because if you apply too much force then you will just push the contents under the skin, okay, deeper into the skin. This can lead to formation of acne and sometimes can lead to darkness and scarring as well. So that is something you do not want. Okay, so be very gentle while you're extracting. And if there are certain blackheads that are just not coming out, just leave it. Don't try to remove it. It is best to visit a dermatologist and get them removed. After removing it with a comedon extractor, you want to apply a small quantity of salicylic acid gel over the affected area, apply a moisturizer on top of this, and leave it on overnight. So this way there will be no accumulation of dead skin in your pores and your skin will look much smoother. If you have a lot of whiteheads, it is best to visit a dermatologist. We make a small nick on the surface of the skin and very gently express the contents out. We can also use RF ablation in order to remove these comedons. Okay, so it depends upon how many comedons you have and how deep they are and how large they are. So depending on that, we'll give you a treatment and also try to extract the comedons. So if you have a lot of whiteheads, it is best to visit a dermatologist and get them removed, and don't try to attempt to remove these at home. So there you go. This was a short video on how to take care of blackheads and whiteheads. I hope you found this video useful. If you like such skin and hair related content, you can follow me on my Instagram handle Dr. Aanchal MD. I post such skin and hair related content daily. Thank you for watching.